is typically known as an older man's disease, but recently more young men are testing positive for prostate cancer. Tonight we show you why men in their 30s may have a cancer concern. Prostate cancer is one of the most common illnesses in men over the age of 60.
1 out of 6 of all American men will be diagnosed with prostate cancer.
But doctors are now seeing the disease in younger men.
We see lots of men in their 50s, 40s, and even 30s with prostate cancer.
Michael Benvenuto was in his mid-30s when he decided to have a blood test to check for the disease.
When I asked the doctor for the test, her initial response was, "You're too young. There's no reason to run this test." And I insisted.
Because of his family history, the doctor finally agreed to run a prostate-specific antigen, or PSA, which measures the risk of having prostate cancer.
Well, the doctor phoned me 2 days later. When you receive a personal call from the doctor, automatically I knew something was up.
Michael, in fact, tested positive for the potentially deadly disease.
I'm the 6th man in my family to be diagnosed with it.
Family history is very important when considering a person's cancer risk, but it's not known if men are actually getting prostate cancer at a younger age, or if the increase is due to men like Michael getting tested earlier. Whatever the case, there is no research to indicate younger men are exposed to anything which could increase their risk.
The reality is that, to the best of our knowledge, there is no specific lifestyle that increases or decreases your risk of prostate cancer.
One of the challenges for doctors is a man can have prostate cancer for years and never know.
The simple fact that you feel well doesn't mean you're off the hook.
I didn't have any symptoms. When I went, it was just for a standard physical.
And that means the disease can go undiagnosed until it's too late.
Prostate cancer can be a fatal illness. We lose approximately 500 Americans every week to prostate cancer.
Michael had surgery and is now cancer-free. He considers himself lucky.
My life could have been shortened a great deal. If I didn't bring this to this doctor's attention, no one would have found it.
And he hopes his story will convince other men to take this cancer concern seriously. Doctors say if you have a family history of prostate cancer, you should insist on your first screenings in your 30s. For more information, head over to our website at WSVN.com.